That's a new option that became available in Italy in the last few months. So since more than 2 years, we have available the combination as fixed duration treatment of Venetoclax plus obinutuzumab. But in the recent past, we achieved the possibility of administering also the combination of Ibrutinib plus Venetoclax, with 3 months of Ibrutinib lead-in, followed by 12 months of the combination of Ibrutinib plus Venetoclax. So now we have different options. The two main paradigms are represented by continuous treatment, generally administered with continuous BTK inhibitors, and two different fixed duration schemes. So now what we discuss is how to define treatment choice based on patient characteristics. And so the data of different trials were recently presented, including the updated 5 years follow-up of the CAPTIVATE study, where in young, fit patients, the combination of Ibrutinib plus Venetoclax was administered as fixed duration regimen. And what we saw is that in terms of progression-free survival, the 5-year progression-free survival remains very high, around 70%. And this is confirmed also in patients with who were previously considered with high-risk CLL, including unmutated immunoglobulin genes. It's true that the progression-free survival curve of patients carrying TP53 aberration is a little bit lower than the cohort of the general population, but still 50% of them remain treatment-free and progression-free after 5 years of follow-up. So we now are trying to understand how to optimize the management in terms of potential toxicities, because we know that with covalent BTK inhibitors, and in particular with Ibrutinib, there is a high risk of atrial fibrillation, hypertension, and in general cardiac events. But we found very promising the possibility of administering treatment with a fixed duration regimen and then allow patients to have treatment-free periods and consider if and when the disease relapses to re-administer the same combination.